August 2022. I accompanied my Bishop, Most Reverend Gabriel Dokumoji SVD, to receive and to commission a new Toyota pickup that was donated by Sanguine Foundation in collaboration with SOSA to the St. Anthony Catholic Hospital, Zoje. I think at that commissioning, my bishop really laid emphasis on the importance of the vehicle to healthcare delivery in the diocese, and particularly St. Anthony Hospital. Before the arrival of this pickup, about 4 vehicles in the facility have broken down, except for a Nissan bus.
As a public health unit, we perform a lot of public health activities by improving the health of individuals in society, by promoting healthy lifestyle, preventing injuries and diseases, and controlling infectious disease with the aim of decreasing hospitalization, higher patient satisfaction, and greater equity in health outcomes. As a unit, we have a need for a vehicle, since our vehicle is broken down at the facility. Hence, we resort on the use of motorbike, that's commercial. With the support from SOSA in collaboration with Sanguine Foundation, the pickup was donated to the Catholic Diocese, to the St. Anthony Hospital, precisely the public health unit, to aid in their public health activities. The coming of the pickup was a blessing to the diocese, as well as to the public health department. Before the donation of the pickup in 2022, staff going on outreach will have to use 3 motorbikes. 2 nurses use 2 motorbikes, whilst other items are packed on the other. Hence, it is difficult conveying all items on the motorbike to the outreach point. With the use of the motor, is inconveniencing to ride in bad weather.
So the pickup came as a piece of good news and relief for the facility, especially the public health unit, because they do a lot of outreach programs. And for them to be very effective in conducting these outreach programs, they needed a vehicle. Before, they were using motorbikes to run these duties. But with the coming of the vehicle, they have been relief. Many of our area of operation become very difficult to reach, particularly in the raining season. And this pickup, being a 4-wheel drive, is able to maneuver through the muddy grounds, and so PHC activities are not curtailed because of the absence of a vehicle. They are ongoing as scheduled. The pickup itself has not been beneficial only to the PHC. It is also used occasionally for other administrative purposes that need the usage of the vehicles. I think myself, as their director, I've had the occasion to use the vehicle in the company of the Vicar General to attend the inauguration of Catholic Health Services Trust in Far Techima. And it was good. We had a brand new and strong pickup to have been able to travel that journey. And so I would want to say that is a precious donation they have made to us.
For instance, when it is raining, getting a motorbike from the outreach point back to the facility is very difficult. Also, the rain-based staffs on their way from outreach point. The pickup is a savior to us. With the help of the pickup, even during rainy season, outreach services are carried out. With the use of the motorbike, staff are prone to road traffic accidents, which is minimal if car is used. During community debates organized by the public health units, the items and staff easily get to the debate ground earlier because the pickup is readily available. Also, community members who needed urgent attention at the community debate are easily moved to the nearest healthcare facility with the help of the pickup. The pickup, apart from its usage by the public health department, it is also used by the hospital when the need arises.
Daniel Elizabeth. Ni kama pocho avwapa vavama. Anyo nkata onwenya ba. Na mi va wo ina gbaro gba oba. Because na nesta over ona na minya na ba. Oyomoko moto. Ita yo chi amagbaro. Aka yo alafia ayo nka mi pocho nchiba adami aji. Ayo vo gbanya le ko mi akovo. Ko kami va. Kami o ha tami kami adile. Katsona mi wo ina kami o mi jokaba.
Previously, we were using motorbikes for our outreach services, and it was not helpful because we go through a lot of challenges before we get to our outreach points. We had an incident of our colleagues getting hurt because of these motorbikes we were using, and it was not helpful, but thanks be to God, SOSA came to our aid, assisting us with a vehicle. For now, we are very happy in getting the vehicle to come to our outreach point and very comfortable in coming to work. And also, before we come to work, so our mothers help us a lot, arranging the place and setting up, waiting for us to come. Before that, too, we call our CIC to inform them that we'll be coming for outreach. So they make information, they talk and tell the mothers we'll be coming on this day. So they prepare waiting for us. Thank you, SOSA, for coming to help us with these outreach services. Thank you. We love you, SOSA.
Transport service is one of the major support services needed in running a health facility like ours in Tentuni Catholic Hospital. And so before the coming of this pickup, we're using motorbikes, which was not serving us properly, because most of the places that we go require a 4x4 vehicle, like the one that they have been donated. And so using pickup for such services was portable, both to the clients and also to the institution, as few people could reach the communities that we needed to reach. And so with the pickup now, we can do a lot of things within a short time. Cost has also reduced in use, and we are able to reach more communities as well. Primary healthcare has also enhanced in the communities because we have the pickup to do the work that we need to do. So for us, the pickup has come at the right time to solve a major need. And we have a transport policy also to ensure its regular maintenance and durability. And for that reason, we will forever be grateful to Sanquin and SOSA Foundations for coming to our aid at the right time. It is our prayer that they will continue to support us in this way for us to deliver service for the good of our clients. It's a noble cause that we encourage them to do, to reach as many clients as possible. Thank you very much for doing so.
Anagla Rebecca Atona Mamponcho Joja Fiagbojo Aitechi Goma Maraku of Wabava Akbara Myangede Chanka Bumalea Nanya Baby Vafi and Demia Jo Wooda all above I have a Moto. Hafiava a donut jamla, Alomia Jo Chianake. Hafiava Hanamina Magbe that a Wabava Demiagila Miamiko Doma Dama. But I never over Kaba Wokovia, come at over with the Viao. I don't know Yana Bido or not me a trader, me up a dome, Akpanami.
We have the responsibility to ensure that the vehicle is maintained, the vehicle is kept on the road and serving the purpose for which the donors have donated the pickup to us. We are not completely satisfied. That is to say, there are so many other areas of need that I know. SOSA has been collaborating with other funding foundations to assist us to get some relief. Like there is this move now with the generator project that is ongoing, maternity projects that are ongoing, all sponsored by SOSA. So we pray for them. We pray for their collaborators that they continue to get the means, the necessary means to support us to be able to deliver healthcare.
So initially, when we were using the motorbikes for the outreach programs, we encountered so many challenges. Among them were our safety. You know, motorbikes and the roads too are not good. So at times that we do have accidents, there were bends of motorbike exhausts that our colleagues suffered. And then the convenience that it conveys us here. At times you call the bike and they will be there in an hour, which you have to wait. And then it delays our work in reaching the mothers to commence outreach programs. Again, at times when you are coming on an outreach, you realize that there are some waterlogged areas which have potholes and then there's water in it. It will splash and then get your uniform dirty. And then by the time you even get to work, you are already soiled. You don't even have that, what do you call, energy or even that joy or excitement to work. But looking at we getting the car now, it's a make everything simple for us. When it's very reliable, anytime you call on the driver, he will bring you to the outreach program. as compared to when we were using the motorbike where it was not reliable. And in terms of our safety, it can now be assured that at least we are saved from getting accident and burnt from motorbike exhaust. And then again, with the motorbikes, we were not able to convey all that we needed to carry out our programs. Example being the infantometer and then the standing scale. That's when the child is 2 years and above, there is no need we hanging the child with the weighing pant. So the child is supposed to stand on the scale, but because we are using maybe one motorbike and then transporting our logistics with the vaccine carrier, we are not able to carry all that we need. So we sort priorities, and then the ones that we will need most, where we leave the infantometer and the scale behind. So when you get to the food, instead of doing all that you are supposed to do, you are sometimes forced to do it in a way that at least it will be successful for you. But now that we have the car, we can convey all that we need. We check our length and then we monitor for growth, and then in case of stunting, we refer to the nutritionist for counseling and then proper care or continuation of care. So the car has helped us a lot in terms of safety, in carrying out our work perfectly, and then in terms of convenience. So the car has been of a great help to us. Thank you.
Maroko nkonyenye gbafa Benis yawa. To fiagbeju. Yeva danavile fiagbeju aitechi agomafia. Nda kama kwenye be huya kokona yovo kona mia edem nyaji alagbegbe. Ala be nesu gado mo na wa fi ova oduna mo alo wa do totro do wa fi ova ikana na be umati vana gasha gamada eyi ko jebo ova ji o kaka huya ka ona neswa ojoji na malagbegbe tika we benye ba chijaja ndokutu vuvun ha wati nwa va da wo gamenyi toji be mia vino ha wapu mia gbo kaba mia ya fon ta joji na kaka mauna yira olo
na tefa aika obumalio mi vana va no fiavu do mia kplodo ga ha o mo fo ta mio amodo kru ga jona aba ga fufu yo mo va va mota mi jona ina da ko ma fi ovava ta kana nya va yi na vuvalia ne bo mi va la fi do ko cha va dungo na ni ati mi o mi ava ta na wona ma ko no ku mi agbo ka ba mi ha mi ide nya fa do mo.
As the head of the Public Health Department and the country representative for SOSA, I'm indebted to SOSA for collaborating with Sound Queen Foundation to donate the pickup to St. Anthony Hospital, public health units precisely through the Kata Akachi Catholic Diocese. Thanks to the president of SOSA, Annemiek de Brackery, her mother and her entire family for inspiring her to support the St. Anthony Hospital as well as the Kata Akachi Catholic Diocese. Thank also to Ton and Sis Hendricks for their support also. All other colleague board members of SOSA Foundation and all those who have supported SOSA in diverse ways. Not forgetting Dr. Rampa, Bishop of the Kata Akachi Catholic Diocese, Most Reverend Do Gabriel Kumoji SVD, The Director of Katakachi Diocese, Reverend Father Lieutenant W.D.K. Straha, retired. Dr. Samuel Foster, former Medical Director, St. Anthony Hospital. Mr. Tumawu Raphael, former Administrator, St. Anthony Hospital. The former Director, Katakachi Diocese, Mr. Christian Akoto Brown. Madam Justina Lonyo, the board chair of the Katakachi Catholic Diocese. The entire staff of St. Anthony Hospital. The public health unit for their dedicated work to bring health care to the doorstep of the people. Also, I'm indebted to Richmond Okomegbe for his sacrifice for SOSA, especially in the outreach activities. Words cannot express how grateful I am to all staff who always participate in our outreach services. To end it all, I'm grateful to the most special person in my life, my father Godfred Christ, for his support on any project that I embarked on. Thank you very much. Akbenami.